So the recording has started. So good evening, friends. We hope you all are maintaining proper social distancing and staying safe. I'm Srikanth Reddy from Richards Community, and we are organizing this event for whole of Frisco and Richwoods. So Bharati Foundation is the organization that we represent. So Bharati Foundation brings you another awareness call of COVID-19 awareness. Bharati Foundation predominantly works on the cultural aspects of Bharat, and it is always in the forefront in organizing yoga, meditation, and moral study camps to kids in and around Frisco area. So it's been almost 3 weeks that we had done a session with Dr. Duggal, Sunil, and we invited Dr. Ramesh Amara this time. Dr. Renuka Garu unfortunately could not join today due to some issues, and thought of inviting Usha Garu. I think Usha Garu is here, but if she's not there, she too had some other issues joining the call, but we invited her. So I mean, it's time that we look into how much water has flown after the last call down the Ganga. So post-relaxation, the news confirms that there is an escalation of COVID-19 cases in Texas. And also the news says it's growing by 1,000 cases every week. So let's get all that information from the frontline soldiers who are the doctors here. So today on the call, we have doctors from Richwoods community, as well Frisco, to speak on COVID-19 post-relaxation status. So those who are still turned on their speakers, could you please mute? Okay, sure. So we did have an interaction with Dr. Duggal last session. Welcome to another session, Dr. Duggal.
Thank you. Appreciate it.
Sure. So Dr. Duggal is currently practicing on clinical infectious diseases, and he earned many accolades for teaching best clinical practices. And he has special interest in emerging infections. Welcome to the session again, Dr. Duggal.
Thank
you.
So
next is we have Dr. Sunil Thummala, who is a certified neurologist and also an MBA in health sector management. He has clinics in Frisco. He has clinics in Frisco and Paris, Texas. He's a rationalist and profound speaker on Oriental and Western philosophies. He'll be hosting this call today. Welcome to the call, Dr. Sunil.
Thank you.
So we have Dr. Ramesh Amara, who has been a primary care internal medicine physician for 21 years here.
Someone is making tea.
I think you want to mute again, everybody.
Sure. So pretty much close. Yeah. So Dr. Ramesh Amara is certified by American Board of Internal Medicine and currently in practice at Texas Health Internal Medicine in Frisco. He's been awarded Excellence in Diabetes, Heart, and Stroke Care by National Committee of Quality Assurance. His other awards include Excellence in Physician Communication, Preventive Healthcare, and Patient-Centered Medical Home. So dear friends, let's have a chat with doctors now. Dr. Sunil, you can host the call now.
Yes, thanks, Srikanth. I think I will go over some statistics as an update since the last time we spoke, and then we'll go over some broad themes. And if you have any questions, please type it into the chat box, or you can send it through WhatsApp, and Srikanth can go over them at the end of the session.
Sure.
We'll start with Dr. Amara. Dr. Amara, I know him as a physician. We have a lot of mutual patients. I never saw him physically, or at least I did not see him on the telemedicine or anything like that either. I just know him as a name. So first time I am seeing him, so at least good to connect a face to the name. Dr. Amara, let's start with what you're observing in the outpatient setting. Are there any trends that you're observing in the outpatient setting? Any changes in the last 4 weeks since the change, since this relaxation has happened and more relaxation is going to happen? Are you observing any change in the trends in the terms of infection rates or the number of patients presenting?
See, my practice mostly is limited to Collin County, especially Frisco. So, in general, we are a healthier county compared to Dallas in terms of COVID-19 infection. So I'm not seeing, again, I don't do a lot of hospital practice. So I'm mostly outpatient. And we had, right now, we are still maintaining 10% of positivity among the tested in Texas health system. So 10.4% sometimes fluctuates between 9.1 to 10.4. So the ratio of positive cases compared to the complete, if you have 100 tests done, it's still maintaining around 10% positive. So it has not increased yet, even though we had, I think the opening has been there only, for the past, I think 1 or 2 weeks, I think. I think Texas, I think it opened just 1 week now, right? I mean, I don't know. I think it's it's slowly opening up, but I don't know it was completely open even 1 week back. I'm not sure exactly when it opened up, but I think it might go higher or not. I'm not sure, but we are maintaining 10% right now of all the people tested, and it's not increasing yet on my watch.
Got it. Dr. Duggal, any updates from the inpatient perspective, like in the number of patients you are seeing in the hospital setting?
No, thankfully, it's not affected us in a bad way right now. We are still seeing almost the same kind of numbers inpatient as compared to before we opened up. And to Dr. Amara's point, partial opening up was May 2nd, and then this this last week they opened up hair salons and nail salons and all those places that I was worried about. So we'll see, and I'm sure we'll talk about the numbers in detail, but as they reported in the news that the last 3 days, Wednesday, Thursday, Friday, the 3 days, the death total in Texas was the highest that's ever been reported. But that should not be counted towards opening up, because if you recall, the deaths will be at least 2 weeks out from the start of symptoms, which are another 3 to 14 days before you get infection. So I think we're looking at about 20 to 28 days of infection before the death started. So the death total is not a result of the opening up on May 2nd. It was the result of infections prior to that. That's my point.
I think I saw some email or something saying that there were like the highest increase on a day basis in the last two days or so. I think looks like a number of cases were reported in the last 2 days on a daily basis compared to the last 1 month or so. I don't know
and
if it's true.
And that you can, there's two factors. One, things have opened up, so people become cavalier and they stop doing what they were doing before that. As you see a lot, and I'm sure all of us have noticed that not everybody is practicing social distancing. Not everybody is wearing masks in closed, crowded settings. So that's one factor. Number two is we are also getting more tests done. So when we're testing more people, we're more likely to find positives as well. Even with asymptomatic people, we're finding more positives in them. So that's why you would see an increase in the number of people who are positive, but I'm hoping that doesn't mean increase in hospitalizations.
Got it. So at least looks like even the percentage of patients who are positive among those patients who are tested in outpatient setting, the percentage is the same, although the total number might have went up a little bit since opening, looks like. Okay.
Agreed.
So Dr. Amara, just give us some brief idea about how the testing process goes in an outpatient setting.
See, when the testing capability was very low, we used to have this criteria, who should be tested. Obviously, the priority was the healthcare worker, the first line responders, and then of course the highest risk people, age-wise, and also mortality, risk factors like cardiovascular disease, chronic lung disease, age factor, diabetes. But I think we have evolved over the past 1 month or 5 weeks. We are kind of opening up more now. Should we limit only to those people, or we should just, the testing capability is more available now. So I think I'm testing more and more now. Obviously we should look for lower respiratory tract infection symptoms, but I think I've done even upper respiratory tract infection symptoms. We have even tested with people even with the low-grade fevers. So the testing capability have improved a lot for the past 4 weeks. So we are testing a lot of people right now in the community setting. But the most highest probability are people with the lower respiratory tract infection symptoms with fever, cough, shortness of breath, and chest X-ray positive infiltrates, and then low oxygen status. But I think we are testing more and more, in the community setting. And then there's also a lot of anxiety and and nervousness among people in the community to find out. So, but we are primarily using a PCR testing at this time. I think that's the standard of care right now to diagnose positive patients right now. But I think our testing capability definitely has improved a lot, and we are using a separate testing center under our organization right now.
If somebody has, let us say, a fever, can they just call one of the primary care office to get tested, or should they wait before they get tested?
You can, obviously, if you have a high, if you have a if you're a healthcare worker, first line responder, I don't think they should wait. If you are a non-healthcare worker, non-first line responder, like typically Indian American community, IT guy who is at home probably for the past 6 weeks, 5 weeks, probably he has a less probability of getting infected. But again, we are the first responders are definitely top priority, but down the road, number 3 is any flu-like illness. If you have a fever and upper respiratory symptoms, any flu-like illness, that could be a COVID-19 infection. So I think they should call. Obviously, if you're a traveler, if you have gone to high-risk areas, people are still traveling a little bit. Most of them are at home, but I've had patients who are traveling to New York City, because they can't prevent it because of the job. They are required to go and sit in New York City for 2 weeks, to meet with the clients and come back. They are definitely a high probability, even though they are not first line responders. But yeah, any flu-like illness with just not a fever, but probably I would wait until you have a upper respiratory tract symptoms. But it does not take too long to get an upper respiratory tract symptom soon after a fever if it's a COVID infection. So most of the time they probably have some upper respiratory tract infections. You don't have to wait for lower respiratory infection, in my opinion. As a community doctor, I would rather catch it early.
Got it. Okay. So if somebody has a fever and maybe some cough, even if it is mild, maybe it's better to call the primary care to get tested.
Yeah, because obviously there are other infections that can be possible, which are equally contagious. Even if, right now it's not influenza season, so probably it's a very low risk of having influenza right now in May and June. But if back in February and March, influenza was still out there, and I think this will continue again into the late this year. So I don't think this will go away. So we are probably dealing with this in October, November, December 2020, and probably early part of 2021, and probably beyond that. So if you look at that context, then yeah, we should be tested anyway. Not just COVID. You should call the doctor for anything. It could be influenza. It could be streptococcus pharyngitis. You should be tested, and they're equally contagious. They equally make you sick. And then have a lot of symptoms. They may not be as severe as COVID-19, but they can cause very bad symptoms too. So yeah. But the most important thing is that even before they call the doctor, I think they should isolate themselves.
Exactly. I think that's very important to isolate so that they don't transmit it to others. Like especially, I think if they are at home and they have children and somebody at home, I think putting a mask if they go outside and calling the PCP, I think that helps. Dr. Duggal, I think I heard today that yesterday, they approved this at-home testing. Is it really useful to get this at-home testing?
Yeah, so the FDA approved at-home testing with 2 companies. One is for the nasal swab, not a nasopharyngeal swab. So it's actually a nasal swab, which is less painful than the nasopharyngeal swab. And the other one is Rutgers University developed the saliva test, which the FDA approved for home collection as well. Now, we have to take these with a grain of salt. There has to be a room for sampling error, because when you do a test at home, no matter how much you teach people, how much you try to educate them how to collect the sample, how to send it in mail, it still requires a lot of legwork before that. Obviously, it minimizes exposure to other people. You know, you can do this test at home, and it also minimizes PPE use, which is a big deal right now, which a lot of places are trying to conserve. So there are pluses and minuses of this. I don't know right now the sensitivity of these tests. I don't know, because we don't have too many numbers right now to say if they're really sensitive to pick up all patients who would have infection, or close to all patients who have infection. But that's a right step in the right direction, in my opinion. You still cannot process any of these tests at home. They have to be mailed out, and the usual turnaround time for these tests is 1 to 5 days. In 1 to 5 days, you'll get the result back from whichever lab you send it to. And most labs have the two tests that have been approved by the FDA. They have their own testing kits that they mail to you, and then you test, and then you send them back. And one of them, actually, I was looking at the requirements. They have you do a video conference with a physician from the company who will advise you how to do the test yourself, so you do it the right way. So they're trying to do everything they can to minimize sampling error.
Yeah, I think in that case, it looks like it is probably better to just call a physician. Looks like a lot of insurances are covering this testing free of charge. And now, you know, a lot of insurances have allowed us to do telemedicine. So we can screen on the telemedicine, and the primary care doctor can screen on the telemedicine. And if necessary, they can arrange the testing at one of the testing centers. And since insurance is covering, probably it is probably the best way, so that we can avoid the false negatives. Looks like, you know, that will be the concern we have.
Correct.
So, going back to this testing, you know, I had one patient who, you know, I was following her for a long time for bad migraines. And this patient calls saying that, you know, she had a bad migraine, and I was not reachable. So she went to an urgent care, and in the urgent care, they did the COVID testing. And she called back saying, I want to come back. I need a nerve block. So I said, no, I can't. My staff was like scared. No, we don't want this patient to come to the office until the result is back. So now she's apparently supposed to wait like 5 days to get the result back. And she says, like, you know, I'm having bad headache. You need to do something. So we ended up, you know, again, treating over the phone with some medications. So looks like some confusion also. Like when somebody gets tested, even though she did not describe a fever, but somehow when she went to urgent care, she got it tested for COVID-19. I don't know the rationale there. So that created some concern among the staff. I think that needs to be, I think, put it in the perspective. Like if you go there and get tested, please inform other people as well, like other providers, so that they can take necessary precautions. Because our clinic policy now, anybody who has symptoms in the last 2 weeks, or anybody who is in contact with who has the symptoms or who has traveled in the last 2 weeks, we are not bringing them to office. We want to screen them on the phone, or if anything we can do on the phone, we are treating them on the phone. Even as a neurologist, we have to do that. But like even like Botox injections for migraine, we have to stop doing that on those patients and delay it for 2 weeks. So that created some problem, but looks like 5 days is a turnaround, and because of the safety of the other patients, and also, you know, the staff members. So if we, if let us say, you know, if a colleague at the office, like now people are going back to office, at least on a limited basis, and a colleague is tested positive. And this is a common thing, you know, Walmart, like one of the Walmart employee was tested positive, and another person is my patient. So what precautions they need to take? It looks like Walmart or maybe major employer has some policies, but is there anything that we need to do in the community if a colleague is tested as a positive?
Well, you know,
go ahead, Ramesh, you talk.
Yeah, see, you know, if you look at what is defined close contact, that's the we need, before we go further, who is this close contact? You know, well, close contact is a family member for sure. You know, if you are living under the same roof, it's a family member. That's definitely a close contact. Now, when can the colleague be a close contact? Well, according to the guideline, either you had shake hands with him, or you were near him within 6 feet for more than 2 minutes.
You have to
That
count
is
that.
called close contact by definition. Now, I've had a lot of patients. They went to a resort in Caribbean, and they told me that there was one worker who got positive. I said, "Who is this worker? You're not a close contact." They just heard the news that there is one employee in the resort who was positive. It's not a close contact. So I think it has to be defined as a close contact, and then I think definitely that person has to isolate himself, or at least watch for symptoms. If he has developed any symptoms, he should be tested. That person should be tested if he develops these symptoms. But the most important thing is, why is that person who's positive came to work? I don't understand that.
Yeah, that's true. That's true. Yeah.
We had patients like that. We had patients like that who are coughing and came to work. And this person, my patient, was very nervous. Why the hell this patient came to work in the first place? If you have a highly positivity probability, you shouldn't even come. Especially this person came from a different country, and within 2 weeks he came to work coughing. First of all, you should have any person coming into the country. Now we don't have a travel outside the country, but back in March, we had a lot of people traveling from China or other countries. They should have self-quarantined for 14 days. That's a rule, even now. You should not have come to work. And if that person has a positive test and the test was pending, you should have stayed home
Until the test is back.
Yeah, until the test is back. And we'll talk about false negative results also. But sometimes if the symptoms are very classical, we should test again one more time.
And what is the obligation of the employee to, is there any obligation for the employee to inform the employer if they test positive? Right now,
well, I don't know how the privacy laws are working in this country right now during the pandemic, but I don't know about that part. I think it's a very specific employer kind of guidelines. But I think when you have a test positive, the county will know. The county health department will know, because all the labs, all the doctors have to report the county, and the county will contact the patient definitely, I think. But yeah, I think you should. I think any patient would definitely tell the employer that he should not come to work. We do the same thing. If you have a strep positive, we don't allow the patient to go back. Influenza positive, don't go. Especially if he's having a fever, an active patient influenza won't go back to work. So the COVID patient with symptoms, especially if he is having a fever or he's having a symptoms where he can transmit the virus, he shouldn't go back to work. I think it is a reasonable expectation of an employee to inform employer.
Got it. So at least the employee is, I think, once this, relaxation happens more, if somebody has symptoms, it is better to isolate themselves and get it tested. And if it is in fact positive, I think since the HIPAA laws are there, we can't inform the employer, but at least I think the employee has to inform the employer. I think there is a moral ground there. I don't know if there's a law there, but at least morally.
If there's a concerned healthcare provider, you should educate his patient to tell the employer. Yeah.
Employer, got it. So, Dr. Duggal, any issues we have to worry about this travel? Now, I think restrictions are getting lifted. People are traveling, as Dr. Amara was referring to. Once they start traveling, anything specific, things that precautions they have to take while they're traveling?
Travel-related precautions are very simple. Try to avoid travel in mass transportation, public transportation vehicles, for example, buses, public transportation trains. And I would try to avoid air travel as much as possible. No matter how much we are careful at the airports, there are so many high risk points at the airport and in the plane that you can easily acquire the infection. Not everybody is wearing masks. So that's another thing. The airlines are not enforcing wearing masks for all the passengers. It's highly encouraged, but they're not required to do that. So that's a risk, because if an asymptomatic transmission is going to happen on the plane, and the person who's infected is not wearing a mask, he can transmit the infection to others easily, because the space is very limited. So there's a lot of risk in traveling in those kind of situations. My suggestion, if if you can travel by road in your own vehicle, that's the best way to travel if you have to travel. Okay. Otherwise, I would not encourage airplane travel at this time, especially with the things opening up and new asymptomatic transmission being reported everywhere throughout the country. Although the wave is not peaked as much as we thought it was going to, but still the risk is high. I would not try to do that if possible.
And certainly, I think cruise ships probably is not a good idea at this time.
I didn't even mention cruise ships there because
no, but Dr. Duggal, even the CDC says to wear the cloth mask when you. I don't know why airlines. Why do we have the airlines enforce it? Because the CDC also already said that to wear the mask when you go in public.
But Dr. Amara, I think the problem is last Thursday I have to argue with patient about their. They said I have right. I don't want to wear a mask.
Yes.
Why are you infringing on my rights? I said this is a private space. This is my office. So I have to argue with him, and he was not happy. And we have one patient. We are telling everybody, please come with a mask. Even if you have attendant, they have to come with a mask. And they're coming without a mask, and we have to ask them to go back. Some of them, drove like 1 hour, and so we don't have adequate masks to give it to them. So we are already rationing our masks. So this created a problem. I think there is not much awareness, and sometimes it's not awareness, but I think there is some stubbornness also there. Today I went on the road just to one of the like temple. It's not yet open, but just went there. And on the way, I have not seen a single person who is wearing a mask. They are just walking in groups. Nobody. It's amazing. Like we were wearing mask in the car, like stupid people. Sitting in the car and wearing a mask, and nobody in the road has any mask. That just is amazing. So coming back to this mask, in our community, there is a concern. Like people are walking on the walkways for their, jogging, a regular evening walk. Obviously, there is a concern that not everybody is wearing a mask. I think that's a good idea for everyone. I would humbly request everyone to wear the mask so that as a courtesy or respect to our community members. But if they do wear mask, what is the risk compared to if they do not wear the mask? Is there any data to support the wearing the mask, at least a cloth mask, if let us say?
As I think when this was raised for the Dr. Fauci and Dr. Birx, at the White House briefings as well. And then, I saw on CDC as well when they were talking about why they are encouraging masks. Now, first, two things. One is that outdoor transmission risk is lower, much lower than indoor transmission risk, number one. Number two, if you are running or if you're jogging, you are more likely to exhale air which goes a further distance, so the droplets can go further out. But still, in general, 6 feet distance is reasonable, even if you're not wearing a mask, to stay 6 feet from the other person who's around you. I mean, you should be okay. But if it's really windy, let's say it's really, really windy, then the risk goes higher. Then it goes 6 to 10 feet. It can go even higher because the droplets can travel in the air longer with the wind. So there's a lot of variables there. If you can wear a cloth mask, you should, to protect others. But I do understand when you go in the open, it's less risk of infection. So I cannot argue with people more about that. If you had asked me this question about wearing cloth masks inside a grocery store or pharmacy, I would be 100% for it. But outside, I think the risk is low. So we cannot tell people to wear masks outside, especially if they're maintaining good distance. So I would say maintain good distance, try to follow common etiquette. If you're running and if there's somebody coming from across from you, you try to get away to one side so you have enough distance between the two of you. So even when you cross paths, it's not right next to each other. So those are the things that people can do, which are common sense things to follow, at least to make sure you don't transmit anything to anybody else.
Dr. Duggal, here is one question. How to recognize common sore throats versus COVID-1?
Yeah, so, the common sore throats, you would say if you don't have a fever, let's say if you don't have a fever, you just have a tickle in your throat like most people say, or have some difficulty in the throat, that you feel some pain there. Those are typically, the fever would be a distinguishing factor in my opinion. When you develop a fever, then I think then you start worrying about, could it be just a common viral pharyngitis, non-COVID, or could it be strep pharyngitis, or could it be COVID infection? And if you get a cough with that, then I think it's less likely to be a viral pharyngitis, then it's more likely COVID infection. Then if you have fever and cough together, the risk is much higher. So as far as throat pain is concerned, if it's not accompanied with fever, I would say less risk. But as soon as you start feeling that you're developing a fever, even with a sore throat, I think it's reasonable to call your doctor, call your primary care physician, talk to them and say, this is what I'm going through, and then they can advise what to do from there on out.
So
I think
do
one
you
of the question I think was, going to doctor's office, how much risk they are taking if they have symptoms like, they have to just go for routine testing. What is the risk they are taking to go to a doctor's office? Let's say Dr. Amara's office, they want to come. And what is the risk? What is the risk they are worried about? What kind of precautions doctor's office are taking to reduce the risk to the patients?
Well, in our office, in our practice, we do follow a very strict guideline about how many number of people are coming into the building, and we maintain a lot of distance between. We have patients who are going for routine testing like blood work or physicals and all that stuff. We maintain very protocol. Uh, there are some practices who are even actually allowing the patients to sit in the car until the exact time of the appointment they're coming into the building, so that at any time there are only few people inside the building, and they're inside the rooms, not in the hallways, not in the waiting rooms. So in my opinion, avoiding doctors just because they get a COVID infection at the doctor's office is not a useful idea. I think they should come. If they are sick, they have to see the doctor anyway. And they have to prove that it's not COVID, then they have to come. I mean, of course, if it's a very COVID-like illness, we are actually telling the patients we can do a video call and have the testing arranged at the testing center. But and in fact, we have questions even at testing center. If you advise the patient to go to testing center, they're worried that they'll get a COVID at the testing center because there's a big group of people there. But even testing centers under Texas Health, we have a 10-minute slots for each patient. So at one point of time, there's only one patient inside the room where the test is being done. The patient sits in the car until he's called upon. And the next patient after him is sitting in the car until the other patient leaves. So that they kind of try to minimize the contact between the population. So in my opinion, I don't think there is, I don't know, Dr. Duggal probably can throw a light on this. I don't think we have proved that there is like a hospital-acquired pneumonia. We don't have a hospital-acquired COVID except the healthcare workers probably. But between the patients, like a patient coming without COVID and acquiring COVID-19 in a hospital, like a hospital-acquired pneumonia, I don't think we have established that yet, Dr. Duggal. So that's why I don't think that's a problem.
You're right. There was a study that was done in New York. Obviously New York has been the worst hit out of all the states. And they actually looked at asymptomatic healthcare professionals in the hospital, and they swabbed their noses. They did the nasopharyngeal PCR, and the percentage carriage rate, which was positive, was similar to the one in the community. So it was not different. So that again justifies that you're not likely to acquire a COVID infection in the hospital, and the risk is about the same. In fact, in the hospitals, most hospitals require each and every single person, no matter what job you have in the hospital, to wear a mask.
Yes.
So you're wearing a mask. Your patient, more likely than not, is wearing a mask. If it's a PUI or a patient under investigation, so the risk of transmission is very, very low in the hospitals.
And regarding
and
the
as far
mask,
as
what do you suggest for
point,
average people, like just going on the, let's say they're going to grocery store. I think people are trying to get, N95 or KN95. What do you suggest? Is cloth mask good enough? I think that's
yes.
bigger concern for a lot of people.
Yeah, so the cloth mask is good enough because, if you follow the directions on the CDC's website on how to prepare these, and if you're able to get a filter also in some of these masks, that's even better. Again, cloth mask should be good enough to prevent your droplets from escaping your mouth and getting settled on surfaces which other people can touch, or directly exposing people who are not wearing masks in the grocery store to your own droplets. And that's to prevent infection in others. And you're trying to do your best as a good citizen. So So cloth masks are good enough. If you have N95 masks or if you have KN95 masks, you're okay to wear them because they obviously are much better. But again, these masks need to be fitted. You can't use a small N95 mask on somebody who has a big face, because then the point is is it's not worth it. Then you
Leakage.
still transmit the droplets around the mask. So I think a cloth mask is good enough, because most of the people who make cloth masks, it goes all the way to your ear, and it covers most of your face. So it's a very, very good design. And I think those are the cheapest and the best options available if you're going to an indoor crowded setting.
Dr.
Yeah,
How
yeah.
do you
Let me add one more thing. And the cloth mask is great, but I still love hand washing. You
Oh
know,
yeah,
uh, so I mean the sanitizer. I think we give more importance to hand washing than even than a sanitizer.
that's true.
That's true.
Obviously, when you're outside your home, you cannot hand wash everywhere. If there's a possibility you can hand wash, that's great. But you probably can use a hand sanitizer while you're outside. But as soon as you come home, as soon as you touch your mask and take it out, you have to wash your hands. Or you touch any other surface outside the home, a shopping cart or something shelves inside a store. Try not touch your face. If you have a mask on, that probably protects you from touching the face. But when you come home, please hand wash with a hand and water and soap, at least for 20 minutes. That's what the recommendation is.
Dr.
how to
Duggal,
clean the mask?
one other question, given the limited availability of the tests, is it necessary to have proactively tests done?
At this point, I don't think it's a good idea, as Dr. Amara had mentioned about when he had talked about testing. Our testing numbers have increased, I must say, in the last 3 to 4 weeks. We have seen a lot more tests available, but we're still not to a point where we can say anybody who wants a test can get a test. We're not to a point right now. So there is no way to proactively test everybody. I would suggest, and I think this is public health important issue, is that when you talk about testing, you should be testing high risk populations more. You should be testing grocery store workers. You should be testing pharmacy store workers. You should be testing big box store workers who are more likely to transmit the infection to multiple other people than to test somebody who's in a closed office space setting where there's only 3 or 4 people working. So I think that's where you need to probably use common sense. And right now, there's no way to do proactive testing on people. No way. We don't have enough tests available.
And how many masks one has to carry? Like, let us say, they go out to grocery store and they had a mask and they came back home. And what do they do with the mask? Should they leave it in the garage, or should they just wash it right away? What is the best suggestion?
Yeah, so my thought is you should have at least 3 or 4 masks that you have hopefully prepared at home, or even if someone made it for you. Most of them are washable masks. Even the filters that they have are washable. So you use one mask and then you have a couple waiting for you, and then you can recycle them, and then make sure you wash the masks that are not being used at the point, so they're all fresh to be used again. So this should be done more and more to prevent the mass from starting to spread the infection in your household. And that's the one thing you don't want to do, is take anything inside your house which could potentially expose your family members who are close contacts.
The N95 mask, we can wash it, doctor?
No.
So the N95 you cannot. N95, if it gets moist, it becomes not effective. But there are certain other masks that are available that people are promoting on the web that I saw, which have filters that can be washed. So the mask itself cannot be washed, but gently cleaned. But the filter can be washed and can be put in the mask again, and then the mask can be used again.
I think one of the suggestion I got was, use a germicidal wipe and clean the outer surface of the mask and put it in a paper bag for 5 days. Yes. N95, that way it becomes dry enough and you can reuse it. Otherwise, if it's moist, I think we should not be using it.
You're correct.
And how about the pets? Is there a possibility of getting the risk from the pets, like when they're walking on the community, and let's say pet has quite some infection? Is it possible to get it from pets or transmit to pets?
Right now, there is no suggestion to suggest, or there's no data to suggest that there is any transmission from animals to humans. And I know there's odd cases reported here and there, but I would not go on that and and do a blanket statement that pets would definitely be the carriers or can affect their own people who own those pets. So I think at this point, after you handle the pets, make sure you wash your hands. Like Dr. Mara mentioned, hand washing is the most important thing. So that you should be doing anyways, and don't, whatever you do, if the pet comes in close proximity, I would still wash your hands because you should be in the habit of doing that anyways. But there is no data to suggest any pet transmission at this time.
But we do advise our patients who are COVID positive not to come in contact, have their pet taken care by someone else.
Sure.
The pet
Sure. I
should
think
not,
yeah, that's a separate question. I think I was talking more about in general, trying to take precaution. But if someone has a COVID positive, if it's a COVID positive patient, and if they have pets at home, yes, they should not be hugging the pets and having the pets come into their isolated area, because then there's a potential of the virus being taken on their skin or on their fur and going to the other family members, and they acquire it. Let's say kids don't wash their hands and then they eat. So that's a potential of transmission. You're correct, Dr. Amara.
Dr. Amara, any specific thing that you would like to advise, particularly at this time? I think a lot of questions, but I think we probably can't go over all these questions. Any specific tidbits you want to add?
See, the general approach should be just assume everything as COVID positive, because that's probably the best. Just make up your mind. Even though you're not sure this is COVID or not, have symptoms, I think the first thing you can do is isolate yourself. We advise the same thing even before pre-COVID era in influenza patients, influenza, all those winter months. We tell patient. In fact, I also approach, if a patient comes into my room, I assume there's a COVID inside the room or there's influenza positive in the room, and then prove that it's not there. You have to take a precaution, put a mask on, put the gloves on before you even enter the patient's room. And then, because my own experience is I got infected sometime with flu from patients because I did not take the precaution and I did not assume that he was positive. Because let's wait for the test to become positive, then no, that's too late. So if the patient has some symptoms, you just have to assume that he's probably there and isolate yourself. The first thing you can do to protect your family from yourself. And then think about action. Is it positive or not? Or let's wait 24 hours, let 48 hours. Let Dr. Duggal say, the fever comes on, other symptoms come on. Yeah, but don't go around, thinking that it's been negative and then find out 2 days, 3 days later, you probably infected people. You probably infected people because, like the incubation period is sometimes very low. Sometimes you can infect people within 2 days, and even sometimes there have been asymptomatic patients, even they try, but obviously, asymptomatic patients, you can't tell whether you're positive or not. You cannot take a real big precaution from your family members. But if you have symptom or mild symptoms, assume that it is there and then try to prove it is not there.
So I think that looks like the best thing to do is, if you are in a closed environment, wear a mask. If you're outside, use your judgment. Better to wear a mask, but if you are able to maintain social distancing, good enough. But if you're in a closed environment like grocery stores, salons, or you're going to some place where there is not much air movement, I think better to wear the mask, at least a cloth mask, and bring it home and probably wash it if it is washable. Otherwise, put it for 5 days, maybe in a breathable bag or something like that. I think that reduces, along with hand washing. Certainly, that's the most important thing which Dr. Amara was emphasizing. I think
we have one more question. Is PIMS that observed in children in some state related to COVID-19?
I read about that. It's PIMS is pediatric inflammatory multisystem disorder, and there's another name. It's called Kawasaki disease. So that's more likely seen in kids and adolescents, and they've reported about almost close to 190 cases in New York right now. But I don't know if all of those patients had COVID infection, because they didn't test those kids for COVID, because currently the kids are not being tested for COVID anyways. But that's something we definitely need to keep an eye on, because it's most of the time it's autoimmune. So it's supposed to be triggered by some sort of, something triggers the infection. So if it is COVID that's triggering the infection, we need to probably find out more about it and see if it's actually related to that. But it's really odd to see that many cases in an area which has the highest number of COVID cases in the country and maybe in the world right now, because New York has the highest number of cases. So I think that's a research that probably will be done. They will be looking into it more, and there's more data that will come out on this.
Sunil, can we open it for
Yeah, go ahead.
questions directly?
Yeah.
Yeah, anyone has a question, please go ahead and unmute yourself. But yeah, you can ask the questions to doctors. Well,
We went over most of the questions
yeah.
Audience have posted.
Yeah.
Yeah, I think I don't see anything new.
No, I
Just
wanted to add, if you look
Just
at
a quick question, I'm sorry.
Go ahead.
Yeah, what kind of medicine COVID positive patients used to get initially, or in a different stages, like I know initial stage or moderate, severe?
Now I'll talk about the outpatient stuff, and Dr. Duggal can talk about inpatient. Outpatient, just symptomatic treatment. We are not recommending any specific, there's so much stuff on the internet, using hydroxychloroquine, azithromycin. There is no proof. In fact, in Texas state, if you write azithromycin prescription, and they are going to not fill the prescription until you tell the reason why you're writing it. And if you write a COVID infection, they're not going to give it to you. Texas pharmacies are stopped doing azithromycin if you say that you're giving for COVID. If it's a valid reason like acute sinusitis, bronchitis, pneumonia, a general pneumonia, antibiotics are given. But for a specific COVID infection, especially milder disease where outpatient that we deal with is just a symptomatic treatment. We have symptoms where people have wheezing from lung disease. You give inhalers. If you have a fever, use Tylenol. Some cough medicine. Aches and pains, you can use some Tylenol to help your symptoms. It's a symptomatic treatment right now. And then inpatient, Dr. Duggal can say.
Yeah, so you're right. Initially there was a lot of talk about hydroxychloroquine and azithromycin, but nowadays in inpatient setting, we are not using that on a regular basis. I do give the option to the patients because anecdotally, I still think hydroxychloroquine has helped a lot of the patients that I've treated, but that is all dependent on so many things that I talk to them about. If they have any kind of heart arrhythmias or if they're on any medications that are contraindicated with hydroxychloroquine, I mention it to them. And then I leave it to the patients to see if they would want to try it in the hospital, because this medication will not be dispensed when they leave the hospital. It has to be completed in the hospital. So that's one. Zinc and hydroxychloroquine combination is not recommended now, so you're right. And then the other medication, the remdesivir, is the new the drug that was approved by the FDA, but that's only to be used for severely sick patients who meet certain criteria, who are critically ill in the ICU. So there's strict criteria for using remdesivir, and remdesivir is now being distributed by the government and not by the company that makes, the Gilead company that makes the drug, because the government is trying to distribute it to places which need it more. So it's tough to get remdesivir right now until you're part of a clinical trial in the hospital. As far as other therapies, the interleukin-6 inhibitor, it's called Actemra. That's another IV medication that's given for people who are extremely sick, and it's not available outpatient. And then there's plasma therapy, that is, you give somebody who is very, very sick with COVID-19 infection, who has multiple organs that are failing. You give those patients preformed antibodies to COVID infection from somebody who is recovered in this form of a plasma donation, and see if they can get better because they can fight the infection better. And that's also a therapy that is very, very difficult to get, but we could arrange that on patients who need it, because there are a lot of people who have recovered from it and are donating their plasma for these purposes. So treatment options are very limited right now.
Thank you, doctor. I'm sorry, just one more quick question. Any multivitamins we can take regularly for adults and kids or anything like that?
I think, there's no harm in, so when we looked at the initial data from South Korea, they talked about adding zinc to the treatment that they were using. So zinc is shown to be beneficial. Vitamin C is shown to be beneficial. Vitamin D3 is used commonly in the hospital as well when we see acutely sick patients. And vitamin B1, thiamine, is also shown to be beneficial. So if you are taking a multivitamin at home, you should be okay, because you should get enough quantity of these vitamins in those multivitamin. If you're not taking one, There's no harm in taking a multivitamin. It's not going to cause any problems for you. I think it's highly recommended. I would recommend to my patients to take multivitamins anyways.
Thank you.
Thank you, Doctor. Doctor, I have one quick question. This is Vidula. So I'm actually seeing a lot of advertisement for swimming summer camp for young kids. How safe is this to send younger kids for summer classes or like swimming classes? Now, and at the same time, I'm seeing a lot of young students, kids, they are playing together. How safe is this in this current situation?
Great question. I think the most important aspect is that right now, again, as we collect more and more information, there is no known data to suggest that COVID is transmitted from in water. So from if you go to an amusement park or if you go to a swimming pool, obviously the risk. I think there's still a risk. I wouldn't say it's okay to do it. If it was my kids, I would say no. I would avoid this right now because we're still trying to gain more information. What if in 2 months they come out and we get more information or more data saying that, yes, it could transmit through that. So we don't want to put our kids or those people at risk. So at this point, I would say take caution and not do that. If you can avoid those kind of camps, I would avoid those. And your second question was kids playing together. I think, again, that also involves their parents, if it's in the same neighborhood, and if the parents are able to talk to each other and make sure none of them have any symptoms. If any of the parents have symptoms, then their kids should not be outside. They should be inside quarantine. But I think that's, again, common sense things. Hopefully, that's okay. I still think that kids don't show any infection. The infection numbers are not high in kids as compared to adults. But I still think that you should just make sure the parents talk to each other and communicate with each other. If their kids are seeing each other almost every day or every other day, it's okay because the family who's close to you or in the same neighborhood. But if you don't know somebody and their kids are trying to play with your kids, I would take precaution and I would make sure that try not to do that. And if you do that, then make sure you talk to the families first.
Right. Thank you.
Sure.
You say daddy walks faster than you. Yeah.
You want to speak up, please.
So, yeah, there is one other question like plasma therapy is covered by insurances.
So plasma therapy, it should be covered by insurance. Right now, any and every aspect of COVID-19 that we see in the inpatient setting is covered by insurance. Okay, so whatever is required to make the patient better is covered. The government is not going to, Medicare is not going to stop any sort of payments for these reimbursements. And most of the commercial carriers will follow what Medicare is doing. So if, God forbid, somebody needs plasma therapy, it should be covered. You shouldn't have to worry about getting a big bill at home.
Yeah, one question on the packages getting delivered. Maybe you might have covered it in the last meeting. We still have to follow, like that's what worries me when things gets delivered at home and going to the grocery stores and bringing them things.
Yeah, so I think that's a good question. As I mentioned, I think in one of the talks I had done before, the packages, the cardboard, the virus can stay on the cardboard for almost 72 hours. So you have to be careful when you get these packages delivered to you. I would say that the best practice would be to make sure you have gloves on, and then you take out whatever the content is in the cardboard box, leave the cardboard box outside in your garage, and take that, whatever you got delivered to you from whichever place, you clean that with a germicidal wipe, and then you can use it and then dispose off your gloves, obviously. But that would be the best way to make sure you don't get any sort of virus that is still on the cardboard into your house and then contaminating surfaces in your house and then potentially causing infection.
How about on the vegetables and on the plastic covers?
So for the vegetables, the best thing to do is, hot water and use some soap and then wash the vegetables with the soap. Soap and water. And then as far as plastic covers, I would get rid of the plastic covers. If it's like strawberries or any kind of berries that come in boxes, I think you can use hot water and run the hot water through those pores that are in those plastic boxes, and they should be able to wash them really nicely. I would say that's the best way to approach it.
Thank you. Really appreciate it.
Sure.
Any other questions?
And I was going to add something. If you look at the public health response to COVID, if you look at the one common thing that every country did is to close the schools very early in the phase. So I still doubt about it. Like a transmission between the kids. We don't have any data because the kids have been staying at home all this time. I have, maybe there is, Dr. Duggal maybe can add on to that, is when the summer happens, when the August schools are supposed to open up, now even the children who got infected during this pandemic, they probably got infected from their parents, right?
Mm-hmm.
Not from the other kids.
No, from the parents most likely.
So, but we also limited the transmission between the kids because we completely closed down the schools all across the planet, and we did very early in the phase. Almost every country did that.
No, you're right, Ramesh. I think it's a great point. I think that's why I was saying that I would be very, very careful. And think about it. If there is transmission among kids are not going to be able to practice social distancing in school. You know that it's not happening. And it's very likely to become a much bigger peak if once the schools open up and there is evidence to show that kids can transmit the infection from each other, and worse, take it to their families and then transmit it to adults. It can also happen the other way around. So I think that's a very good point. I think we should hopefully in the next few months get more information as well about, hopefully get more testing available, and that way we can test more people. And especially we need to figure out what the policy is going to be for the kids going back to school everywhere. Not only elementary school or middle schools. You talk about high schools, you talk about universities. All these things, they need to be opened up. As they're saying that most universities will open in the fall. But I'm concerned about that because I think that's where you would probably get a second wave or third wave where these peaks would go up almost everywhere where these students are in close proximity to each other. Unless they somehow develop some sort of protocol to social distancing in the class on the campus, which I think it's easier said than done.
Doctor, probably I have asked this question in the previous session also. So the flare-up is really high in US, right? Comparative to India and generally in comparison. So why that is happening?
I think here's my response. I was talking to my brother, he lives in Punjab, and he was talking to me that the one good thing India did is India has cracked down so much on potential transmission at the grassroots level. He works in this excise and taxation department, but he told me that the government of each state is so strict, and the central government is so strict about if you have anybody who has any mild symptoms even, and there's a report of that, they call their doctor, they are absolutely quarantined at home. They're not allowed to go anywhere for 14 days, and they are getting groceries delivered to their door. And a lot of these services are being provided in India, which I'm amazed in a country like ours with more than 1 billion people, they're able to do that. And us here in the US have been hammered by this infection because we were thinking that we were invincible and nothing would happen to us. So I think that's a mindset also. And I'm proud to say that, it's actually done wonders in India right now.
Well, I was talking about that too, a few of my friends. I think the common sense part is more in that country, India.
Mm-hmm.
I think, and then if you look at the number of people, I never saw any protests. People who were poor could not continue social isolation because they did that out of poverty, but because they came out of their isolation because traveled to their villages, but they did not do it as a part of a protest.
Mm-hmm.
And now here the culture is different. I think the protest is there because they really don't want a lockdown because they're talking about their rights and everything. But even if you look at things like simple wearing a cloth mask,
mm-hmm.
If you look at, there was one data, 70% of Indians wore cloth mask even before it became a CDC guideline here.
Mm-hmm.
This is just simple common sense. People put a cloth mask even walking on the road because there's so much dust on the roads. If you look at Hyderabad, where I come from, everybody's because there's so much pollution, they're putting a cloth mask on just like a pollution thing. But I think I was also talking about reading about that role of BCG vaccination, Dr. Duggal.
Mhm.
I think there is a
So-
trial going on in the United States about that. I think that's very interesting piece of information. There's something that we
Yes.
did right. Looks like.
Yeah, and it looks like the same. They looked at there was a guy from Germany who was in one of the research institutes in Germany. He was also looking at the BCG extract and looking at the protective effect on the immunity. Basically, the BCG has boosted the immunity of people who have had the vaccination, and that seems to have helped against developing severe symptoms from COVID-19. So that may be one of the reasons why we're seeing not so many severe infections. But I'm sure if there's minor infections, in a country like ours, not everybody goes to the doctor for minor things. You know that. So I think they may be underreporting as well. But I think more commonly, I think you're right. A lot of people are following common sense over there, and I think that's what has helped us.
But in India, they are testing only with severe infections.
Yeah.
Well, the logic says that if you have a severe symptom, most likely the positive rate should be higher.
Mhm.
But that's still 3% in India, I think, the last time I heard. And here it is 10%.
Mhm.
Even though we are seeing some milder symptoms, we are testing positive. So I think I don't know, there is something there.
Yeah, I think you're right. I mean, I agree with you. I think the BCG vaccination, it's very intriguing. I'm sure there'll be more information that comes out. We probably will get more information from Germany and from the trial being done here. I think they will give us a lot of information. As far as one, I wanted to just touch on vaccination. I know everybody has been asking me about that as well. I know there's a lot of countries that have fast-tracked vaccination. Oxford is doing that, or they're saying that they are coming out of the vaccine in the fall. But in true, if you need to develop a good vaccine, you need to have all the phase trials done on the vaccine, where you also look for efficacy, you look for safety, you look for long-term side effects and adverse effects. So I think the earliest we're looking at as far as getting a good vaccine that would be able to be safe and not have too many adverse effects would be early part of next year. That would be the earliest I would say we would be able to get something available. And then once that is available, then I would highly advise everybody to get the vaccination. And that way we can develop this herd immunity, or everybody gets the vaccination, so develop antibodies, and then the antibodies hopefully are protective for a long period of time. So let's see what happens. But I think once the vaccination comes out, it'll be a big step in trying to minimize this infection.
And just a quick question, doctor. Like, as a doctor, what do you see? Like, is vaccine coming for sure, which will be work like 100%, or?
So yeah, I think as I mentioned, the vaccine is coming for sure. There's no doubt. Everybody's working on it. And just recently, the White House had mentioned that they're getting the Department of Defense to get in on this, so they can expedite the vaccination protocol and do everything that needs to be done to make sure the vaccine is available. It is coming out. There's no doubt. The question is, how effective is it going to be? That we don't know right now, and we will find out more, because if they collaborate with the other countries, if UK or Australia or New Zealand or some other country comes out with the vaccination, or even Israel, I know that Israel was developing a vaccine as well. If they come out with a vaccination, I'm sure the US companies will talk to those counterparts and see if they can get the information from them and try to see if that is safe. And if it is safe, maybe they will, FDA will expedite the use of that vaccination in the US as well. But I think that's all a question that needs to be answered down the road.
Thank you.
Sure.
Yeah, one question is, yes, vaccination is too far from today, but do you see any news on a good medication that can treat this COVID-19 soon?
Right now, unfortunately, no. And whatever the data is on the remdesivir drug that showed decrease in the length of stay, but was all in the hospital. So that's only for hospitalized patients. It's given IV. It cannot be used as in the outpatient setting. So Dr. Amara and I, if I have outpatient patients, I cannot treat them with anything for COVID as of right now. And I'm not sure if there's any drugs that would be effective as of now, but we'll see. We'll see as everybody's working on getting something done.
But I want to add something to the listener. If you look at the symptom, the patients who are getting better, 81% of the people is being taken care by the nature. They are recovering 81%. So a drug, an outpatient setting, has to be better than 81%. That's very difficult to achieve.
Yeah.
In a viral infection. especially respiratory virus infection. That's my logic.
I think you're right. I think by the time people get to the hospital, they are obviously sicker than the other, most of the majority of the people who are affected by the virus. So you're right. Most of the people should be able to fight this off. One other thing is we don't know which patient would be okay and not get admitted to the hospital in 2 days with hypoxia, and which patient would be not okay. So we cannot predict that. That's the uncertainty of this disease, is what we are fighting against, is we don't know. There's so much unknown right now. And hopefully we get more information as we get more and more data from the patients who've been affected.
Doctor, recently the British PM, Boris Johnson, he was affected with COVID, right? So was it a drug that cured him, or the immunity that brought him out of it?
I don't know. I think he was in the hospital, as far as I can recall, at least for 2 weeks.
ICU also.
Initially, yeah. So he was in the hospital. I'm sure they gave him these drugs that I've talked about before. I'm sure he got some of those drugs. I don't know if those drugs helped him, or if he was able to fight off the infection after getting supporting care in the hospital and then just fighting it off on his own. I don't know what his medical problems were and what his risk factors were. So I think it's tough to say what helped him, but I'm sure, being the prime minister of a very developed country, I'm sure he got access to a lot of these medications that we're talking about.
Yeah, that's
right. Got a quick question. So, like, if someone gets COVID, like, what are the long-term effects after they get it? Would they still have breathing problems?
Once you recover from this infection, you should not have any long-term breathing problems, because most of the breathing problems are caused by the effect of the inflammatory response by the person who gets affected. And the virus has done its thing, it causes inflammation in the lungs, and the person fights off the viral infection, and that's the tussle that causes people to get sick. So once you recover from this infection, your body should be able to, not have any long-term lung problems. As far as fatigue and loss of appetite and energy levels, and I hear patients tell me, when I follow up with them, when they have been released from the hospital, the COVID patients who I see, it takes about almost 4 to 6 to almost 8 weeks sometimes for these people to get back to their normal routine, where they're able to do what they were doing in the past without getting feeling like, oh, they don't have enough energy, or they don't feel like their appetite is good enough. So in those settings, as Dr. Amara was saying, you need to be able to have a healthy diet. You need to be able to take multivitamins, do everything that you can do non-pharmaceutically, and try to, recover from the infection faster. So that's what I would suggest is, do that. You should not have any problems with respiratory symptoms, at least from a structural standpoint in the lungs.
Thank you.
Sure.
Sunil, you want to take over? Yeah.
Yeah, I think we are done for the questions, right?
Yeah.
Yeah. So go ahead. So you can wrap up here.
Sure. So, doctors, do you want to say any last word for the residents?
Well, I want to tell the community that, there's no need to panic. It's still, I'm not saying that it is not important, but if you look at, from my angle, I'm an outpatient guy. We had few COVID patients who have all recovered very well. Of course, they were all young, with less comorbidity, 26-year-old, 45-year-olds, the regular, healthier patients, much younger ones. I think they recovered very well. I think if it's a mild disease, it does take 14 days. But as Dr. Duggal said, if it's a little severe disease, because he sees more hospital patients, they take 3 to 6 weeks to get recovery. But none of my patients went to the hospital, but they all got better. In outpatient setting, I think it's a great news. I know it does not mean that you have to be, down your guard. You still have to be protective of yourself, even though, because there's still a possibility that you can get severe symptoms. But there's no reason to panic. We just have to face it as a community and as a, it's an effort. That's what people saying, right? My mask will protect you, and your mask will protect me. That's what it is.
Yeah, and I would like to tack on to that the good thing going for us in Texas in general is the area is large, and the population density per square foot is less as compared to places that have been bombarded with cases like New York, where the population density is very high. So that's in our favor. And number two, I think still do the social distancing, still do the cloth mask when you go into a crowded store. If you go to do grocery shopping or pharmacies, those are the most common areas. Now I know the restaurants have opened up as well, and I would say take caution. Try to still. I would, if it was me, I would still take out and bring the food home. I would not go sit in a restaurant and expose myself unnecessarily, even though they are trying to take all the precautions there as well. We are going to support the economy of the city and of this region, but we can also support that by taking food out from the restaurants and not sitting there and eating there. So we're still helping out in that way.
Sure. Thank you, Doctor. Sunil, you want to have a last word?
Yeah. So obviously, I think I'll reiterate that. Obviously, it looks like hand washing is the key. Wash your hands repeatedly whenever there is a concern. Whenever you touch your doors, wash your hands, and please wear masks if you are outside as a courtesy to your neighbors. I think that was one of the biggest concern in WhatsApp groups we had. So I would just say, as a courtesy, just wear it. Maybe it will help everybody else to reduce their anxiety. I don't know whether it really helps outside, but at least it helps to reduce their anxiety, others' anxiety. So just please wear it. And again, thanks to Dr. Duggal and Dr. Amara, for spending this time today.
Thank you very much.
It was like,
Sure.
Sunday evening, and obviously, it's a very useful information for everybody in the community. Thanks a lot.
Sure.
So a big thank you to all the residents of Frisco and Richwood especially. And I really thank Dr. Ramesh Amara and Dr. Duggal. Thank you so much.
Wish you all good night and have good health.
We'll continue doing these sessions in future too, as long as the COVID is going on. And Sunil, for hosting the call, that valuable questions that you ask is definitely very informative. Thank you all for joining, and
Sure.
we'll end the session here.
Thank you.
Thank you.
Thanks, Doctor.
Thank you so much.
For providing
Thank
this.
you.
Thank you, Dr.
Thank you for coordinating too.
Sure.
No problem.